It's James Pritchett in my downtown Seattle office, and I'm going to talk a little bit today about the development of shoulder implants as they occurred. And originally, shoulder implant for a shoulder replacement looked something like this: ball on the stem, nothing too exotic. This is a variation of a near prosthesis, and it came out in the 1950s. It was very popular, often used for severe arthritis or a bad fracture of the shoulder. When need for a socket part of the shoulder came along, things got a little more complicated. And polymers were suggested as the best socket material. And I'll just show you a typical polymer. This is unmachined. This is just a polymer. This is, in this case, polyurethane. And it didn't become very popular for implants, but it turns out for the shoulder was the very first socket material that was used. It was used in 1958 originally, and that became the first total shoulder implant, meaning the ball and the socket were both treated. So that's what it looked like. It looked like this today, and now it might be a little whiter color. Polyethylene would be used rather than urethane. This box that I'm holding here was given to me many years ago by one of the real pioneers in our city, Bob Romano, who was a great man with a lot of different interests. He pioneered hip replacements probably more than anything else. He also had an interest in prosthetic fitting for amputees. He had a number of interests, but the shoulder certainly was something he worked on his entire career, and particularly the socket part. The problem with the socket of the shoulder is it's very shallow, and the tendons are not always supported. So he did some animal experiments, and he also did patients who were willing. And this is in a bygone era. He practiced between the 1950s. I think he went into practice in 1955. He had a very long career. He continued to practice till about 2001, and he was active the whole time in his shoulder operations. This is a very small shoulder, and you can see the plastic material. This time, he actually had the socket so it would snap onto the ball, so it'd be very secure. And he spent a lot of time trying to decide, this one has some cement on it and a peg, and then he would have different things that he tried from time to time. Here's one with has some screws, and this is the joint itself is metal in that case. There's another one of his variations. I'm showing you all these in this box because none of these worked out the way he wanted it to. He then tried implants that were very stout, the ball in between a socket piece and a stem piece. He, for a time, made a hole in it and passed Gore-Tex as a little rope connecting the ball and the socket. And then he eventually concluded that none of those were the answer, and just a regular shoulder implant with a standard plastic socket and a ball was the way to go. And others came up with the clever idea, primarily in France, of putting the socket on the ball part and the ball on the socket part. And that's now, if we can't make a shoulder stay together, how we do it. Dr. Romano, interestingly, retired the very first year that we were able to do this operation. He did come by and on occasion from time to time and see the patients. His prediction was it wouldn't probably work out, and it hasn't entirely, but it's been an advance. And I'll show one other implant, because this isn't from another pioneer on the shoulder, Dr. Townley, who interestingly did the first, as far as we can tell, total shoulder with a resurfacing socket. And this is, of course, a total shoulder itself. And this was actually one for a patient, custom made. This one, he had a base that he secured with a spike, and it had some screws, a plastic socket which snapped together, and he had a white zirconium ball that snapped in it, and then of course the stem inside the patient. And this was a dramatically successful and stable shoulder that had a potential for full range of motion, full stability. The trouble was the forces on the bone were too great, and ultimately it failed. And this particular implant, this is a prototype, turned out to be his last operation of his 53-year career. The very last operation that he did at age 86 years old was this implant. And this is the prototype of the one he made shortly before implanting that. He was very proud of it and made a gift of it to me. So have it here for interest.